Hello, good morning everyone. I am Dr. Pranathi, Senior Consultant and Head of the Department of Ophthalmology, KIMS Eye Care, KIMS Group of Hospitals, Secunderabad. Let's discuss about the other myths about the conjunctivitis. As we all know, we are seeing an epidemic of pink eye now in the Hyderabad. Pink eye is nothing but the conjunctivitis, means it is the inflammation or infection of the outermost layer of the eyeball, that is conjunctiva. Because of the heavy rains and so much of contamination we are seeing around, there is very rampant increase in the number of cases we are seeing day to day. This conjunctivitis is mainly caused by the adenovirus and it is very contagious, means those who get exposed to the patients who have conjunctivitis, means if they come in close contact with those patients, or if they do use or share the towels or bed sheets which are used by the patient who has the conjunctivitis, it spreads very rapidly, and once the patient gets the conjunctivitis, it takes at least 1 to 2 weeks for him to recover. Means these 2 weeks, these patients are infectious. So whoever gets conjunctivitis, I would recommend them to isolate themselves. Means if it is kids, please to isolate those kids from the other kids so that it doesn't spread from one kid to the other. And whoever is taking care of the kid, mothers, after they put the eye drops, they should keep washing their hands. Hand hygiene is very important. Without washing their hands, if they touch their eyeballs, even they get infected with the conjunctivitis. The precautions which we need to take to prevent the conjunctivitis spread from one another is basically hand hygiene. Means whenever we are touching any surfaces, maybe it's a door handle or the tables which we are having in our workplaces or any other surface, we should wash our hands thoroughly before we touch our eyes, because conjunctivitis mainly spreads through the secretions of the patient who have conjunctivitis, or if the patient is having any throat infection, even the droplets which settle on the surfaces will cause the spread of the infection. So hand hygiene and preventing close contact with those patients who already have conjunctivitis or any other throat infection, and in case if you develop any symptoms, immediately you should wash your eyes, and if possible, if you are at home, you give warm compression. It's a basic conservative measure. You give the warm compression. If there is some amount of bacteria or viruses which have entered the eye, you will have immediate slight improvement or relief. Next, coming to the treatment of the conjunctivitis. These days patients are having a lot of Google search and they believe there is no cure for conjunctivitis. That is not true. Whatever cases which we are seeing here, most of them, around 50% or more, are very mild. Very mild conjunctivitis means they are exposed to an adenoviral conjunctivitis and they are having just eye redness and eye itching. If the patient develops any eye itching or redness, a simple lubricating drop or a simple antihistaminic drop to prevent the itching and cold compression will be sufficient. If these patients develop secondary bacterial infection, then we do add some antibiotic eye drops. The main treatment for this conjunctivitis is to prevent further progression. Means in case if the patient are having simple symptoms just like eye redness, eye watering, do consult the nearest doctor. Once they prescribe their drops, to put them regularly, and you isolate yourself for 1 to 2 weeks from others. But in case if you have developed any symptoms which will affect your vision, do consult back your ophthalmologist immediately, because as I told you, conjunctivitis is the infection of the conjunctiva of the eyeball. But if it is severe, which we see around in 5 to 10% of the patients, spreads to the cornea. If it spreads to the cornea, patients start experiencing blurring of the vision. So if you have any blurring of the vision or if the eye pain is increasing, then consult your ophthalmologist immediately so that you will be advised other drops to prevent further progression of the infection. And regarding the recurrence, most of the people do believe that once they get conjunctivitis, they will not get it again. It is not true. As I told you, it is an infection. It spreads from one patient to the other, whoever is having infection. So in case after you recover well, again after 2-3 weeks later, you get exposed to one more patient who has conjunctivitis, there is chance of recurrence. So even after you recover from conjunctivitis, please do maintain proper social distance from patients who have conjunctivitis and do follow the hand hygiene rules. Thank you.